Nigeria is paying the price for the low vaccination rates for a number of vaccine-preventable diseases because of a number of factors, including reluctance of citizens to make themselves available, particularly in semi-urban and rural areas. That's the view of the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Ifedayo Adetifa. He told Channels Television's Ladia Keridulale on our current affairs program Newsnight that ailments such as yellow fever, cholera and meningitis continue to take a toll on human health within the country because the momentum for vaccination was also interrupted by the arrival of the COVID-19 pandemic, and that health agencies are restarting awareness campaigns.
We've had historical challenges with vaccination coverage. We've had our sister agency, the NPHCDA, working hard to, in more recent times, to actually bring about gains. And just as the country seemed to be gaining some momentum with concurrent efforts to strengthen routine immunization and then conduct mass campaigns in response to the areas that we know are undercovered, COVID. And of course, with COVID, all of the issues at that time, health lockdown, movement restrictions, people were afraid of going to hospital. You couldn't convince any parents to take their child to a hospital because that is where you are more likely to get COVID and the like. So there were disruptions to immunization, both routine and planned campaigns. The world tried to recover, to sort of say, look, essential services should return, but we know that the journey to doing that has been really hard. And now what we are seeing is we are now paying the price for the gaps that occurred there. What we are keeping an eye on and what we are looking after as the NCDC is not what the headlines reflect. So the fact that, yes, everybody's talking about monkeypox, talking about COVID uptick now, does not reflect our priorities. We have to look after everything that turns up. So yes, we are already seeing cholera. We have been seeing cholera for a few months now. We're expecting an uptick as the rains become established and of that. Ahead of November, we're already preparing for meningitis and preparing again for the next Lassa fever season, unfortunately. And then we're also keeping an eye on, okay, if unmitigated transmission is going on, we're going to have all this U-type travel. Are we going to have another uptick in COVID cases again like we had with Omicron? You know, Omicron basically arrived with the end of the year in 2021. So, as I said, it's very, we are fighting wars on many fronts. So yes, we tend to always be spread out a little thin. But the important thing also is that, I mean, it's not just us, it's that we depend a lot on the states who are basically the front lines.
For the full interview with the DG of the NCDC, do watch Newsnight tomorrow, Monday, September 19th at 9 p.m. right here on Channels Television.